Welcome back to Med School Radio. We are looking at Anki, so let's go ahead and answer some of the questions. Polycythemia vera is characterized by blank plasma volume. It's characterized by increased plasma volume. Proliferation of the B cell compartment of lymph nodes causes what type of hyperplasia? For example, rheumatoid arthritis, early stages of HIV infection. It is follicular hyperplasia. For example, rheumatoid arthritis, early stages of HIV infections. So notice the follicles are located in the cortex. Blank lymphadenopathy, painful or painless, can be seen with chronic inflammation, metastatic carcinoma, or lymphoma. It's painless lymphadenopathy. Is follicular lymphoma typically aggressive or indolent? It's indolent. Myelodysplastic syndromes rarely may progress to acute myeloid leukemia. Most patients die from infection or bleeding before the myelodysplastic syndrome progresses. Polycythemia vera is a form of what type of polycythemia? Primary polycythemia. Risk factors for acute myeloid leukemia include prior exposure to blank chemotherapy and radiation. Ankylating chemotherapy. Let's read that again. The risk factors for acute myeloid leukemia, or AML, include prior exposure to ankylating chemotherapy and radiation. Okay, ALL, acute lymphoblastic leukemia, is associated with blank syndrome, usually arises after the age of 5 years. Down syndrome. Amlodipine versus lisinopril. Remember that amlodipine showed more consistent control of blood pressure over a 24-hour period, in contrast to lisinopril, which exerted its greatest effect during the daytime. Cyclobenzaprine, what is it used for? Muscle spasms from musculoskeletal conditions of sudden onset. What is the major source of energy during the first 2 to 7 seconds of exercise? Creatine phosphate. The enzyme blank is deficient in Lesch-Nyhan syndrome. HGPRT. When blank glucose units remain on a branch of glycogen, debranching enzyme moves 3 molecules of glucose 1-phosphate from the branch to the linkage. 4 glucose units. Homocysteine may be converted to methionine via the enzyme methionine synthase with blank and blank as cofactors, methyl THF and vitamin B12. In the blood, free radicals may take an electron from apoprotein, blank on LDL, forming oxidized LDL. B100. A blank enzyme transfers CO2 groups, usually with the help of biotin. Carboxylase, for example, pyruvate carboxylase. Sucrose is converted into fructose and glucose by the enzyme sucrase. What class of drugs may bind to and inhibit complex 1 of the ETC? Barbiturates. The enzyme blank is deficient in Hurler syndrome. Alpha L iduronidase. 1,3-bisphosphoglycerate is converted into via the enzyme phosphoglycerate kinase. It's converted into 3-phosphoglycerate via the enzyme phosphoglycerate kinase. Ketoacidosis may cause the breath to have a fruity odor due to exhaled acetone. And blank is a chromosome with 2 copies of one arm and no copies of the other, an isochromosome. If a disease has an X-linked dominant inheritance pattern, there is no blank transmission, male-to-male transmission. Alkaptonuria is a metabolic disorder associated with what colored urine after prolonged exposure to air? Black colored urine. Blank are cylindrical outer structure composed of a helical array of polymerized heterodimers of alpha and beta tubulin. We're talking about microtubules. Where in a cell does N-linked oligosaccharide addition take place? Rough endoplasmic reticulum. Elastin is rich in non-hydroxylated blank and blank residues. These are amino acids. We're talking about proline, glycine, and lysine residues. mRNA quality control occurs at blank, which contain exonucleases, decapping enzymes, and microRNAs. Cytoplasmic processing bodies, also known as P-bodies. Collagen is a repeat of a tripeptide of what? Made by fibroblasts. GLY, X, and Y. Gly, X, and Y. Okay, that's collagen. X and Y are usually proline or lysine. One post-transcriptional modification is the blank of introns, the splicing out of introns. What sequence of nucleotides is repeated in myotonic dystrophy? CTG. Remember, ex-girlfriend's first aid helped ace my test. What type of collagen makes up reticulin fibers? Type 3. Vitamin B9 or folate deficiency most commonly occurs due to pregnancy, blank, or drugs. For example, phenytoin, sulfonamides, and methotrexate. Alcoholism. It may also occur due to malnutrition, malabsorption, and hemolytic anemia. Vitamin what? What type of vitamin is necessary for the hydroxylation of proline and lysine in collagen synthesis? That's vitamin C. What is the effect of endocannabinoids on appetite? Increased, the munchies. Why is oral glucose more powerful stimulant of insulin secretion than IV glucose? Because oral glucose stimulates secretion of GIP and GLP-1. The what, the blank of the islet of Langerhans, contains mostly beta cells. We're talking about the central core. What is the embryonic origin of thyroid tissue? Endoderm. Thyroid diverticulum arises at the primitive pharynx and then descends into the neck along the thyroglossal duct. Insulin results in blank potassium uptake into the cells, increased potassium uptake into the cells by increasing the activity of the sodium-potassium ATPase pump. Polycythemia vera is characterized by increased plasma volume. Treatment for acute intermittent porphyria include what and what, which inhibit ALA synthesis, heme and glucose. Lead poisoning presents in children exposed to lead paint with what type of deterioration? Mental deterioration. What type of leukocyte defends against helminthic infections? Eosinophils. What type of cytosis refers to cells of varying shapes? Poikilocytosis. Basophilia is uncommon but can be a sign of myeloproliferative disease, particularly what? CML. What ABO type is the universal recipient of red blood cells? Type AB. Corey disease presents as a milder form of von Gerke with blank blood lactate levels. Normal blood lactate levels. In erythrocytes, 90% of glucose is used for what? Glycolysis. The remaining 10% is used in the HMP shunt. What anemia presents with short stature, craniofacial abnormalities, and triphalangeal thumbs? Diamond Blackfan anemia. Most cases of serum sickness are now caused by drugs acting as haptens. Administration of vaccines is an example of what type of immunization? Active immunization. Differentiation of helper T cells into Th2 is inhibited by what? Interferon gamma from Th1 cells. Which region of the lymph node enlarges during an extreme cellular immune response? For example, viral infection. The paracortex. Diagnosis of amyloidosis requires what? Remember that the abdominal fat pad and the rectum are easily accessible targets. You need a tissue biopsy for diagnosis of amyloidosis. Which cellular change is characterized by a decrease in tissue mass due to a decrease in size or number of cells? That's atrophy. Which cellular change is characterized by replacement of one cell type by another? Metaplasia. Holoprosencephaly is seen in Patau syndrome and what other syndrome? Fetal alcohol syndrome. The third ventricle drains into the fourth ventricle via the cerebral aqueduct of Sylvius. Brown-Saccade syndrome presents with ipsilateral what motor neuron signs at the level of the lesion? Lower motor neuron signs at the level of the lesion. The Charcot triad of blank may be remembered with the mnemonic SIN. S is for scanning speech, I intention tremor, also incontinence at INO, and nystagmus. Multiple sclerosis. The Charcot triad of multiple sclerosis. Central pontine myelinolysis is also referred to as osmotic demyelination syndrome. Mild global cerebral ischemia may occur with repeated episodes of what? Hypoglycemia, for example with an insulinoma. Risk factors for berry aneurysms include advanced age, hypertension, smoking, and race. We're talking about an increased risk in what? Blacks. They have an increased risk for berry aneurysms. Bacterial meningitis is associated with what glucose in the CSF? Decreased glucose in the CSF. Okay, we're looking at a picture here to ID a sulcus. We're looking at the calcarine sulcus. The next one I'm looking at is to ID a nucleus. We're looking at the spinal trigeminal nucleus. Next is a cranial nerve. We're looking at the trigeminal nerve or cranial nerve 5. Next is a gyrus. We're looking at the precentral gyrus. And now we're going to look at a tract in the caudal medulla. It is the spinocerebellar tract. Next question, is glucokinase activity induced by insulin? Yes. Regeneration of 11-cis retinol from all trans retinol requires vitamin what? A. Deficiency of vitamin A causes night blindness. What type of pupil is unilaterally dilated pupil that reacts sluggishly to light, but better to accommodation? An AD pupil, ADIE pupil. This is a ciliary ganglion lesion. What is the most common cause of hospital readmission in patients with Medicare? CHF. What is the most common cause of death in infants less than 1 year old? Congenital malformation. Changes in the elderly include what type of muscle mass and fat? Decreased muscle mass and increased fat. Alkaptonuria is a metabolic disorder associated with what colored urine after prolonged exposure to air? Black. By what age does an infant develop object permanence? 9 months. How does intelligence change in the elderly? No change. However, memory loss does occur. Which major medical insurance plan limits patients to a network of doctors, specialists, and hospitals without requirement of referrals? Exclusive Provider Organizations, or EPOs. By what age does the infant orient to voice? And what about orient to name? For voice it is 4 months, and for name it is 9 months. Which part of Medicare provides hospital insurance and home hospice care? Part A. Which healthcare payment model involves patients paying for each individual service at a predetermined discounted rate? Discounted fee for service. Do patients with point of service insurance plans require PCP referral for specialist visits? Yes. By what age can a toddler kick a ball? 24 months. Which part of Medicare provides basic medical bills and hospital insurance, home hospice care? Part C. By what age does an infant develop a pincer grasp? 10 months. As horseshoe kidneys ascend from the pelvis during fetal development, they get trapped under the what artery and remain low in the abdomen? The inferior mesenteric. Denny's-Drash syndrome is a combination of what? Wilms tumor, early onset nephrotic syndrome, and male pseudohermaphroditism. Which renal arteriole is more commonly affected by non-enzymatic glycosylation? It is the efferent arteriole. What type of azotemia is due to decreased renal blood flow, for example, cardiac failure or hypotension? Pre-renal aesotemia. Which renal tumor is characterized by large eosinophilic cells with abundant mitochondria, but without perinuclear clearing? That's renal oncocytoma. Is the hereditary form of renal cell carcinoma typically uni or bilateral? It's bilateral. Remember, the sporadic form is classically a single tumor. The liver packages triglycerides and cholesterol into what? Which enter the blood? Into VLDLs. Risk factors for developing breast cancer are generally associated with increased what exposure? Estrogen. Elevated levels of HCG, for example with a choriocarcinoma, may cause gynecomastia for males or blank due to homology between HCG and TSH, FSH, and LH. We're talking about hyperthyroidism. What serum markers may be elevated in dysgerminoma? LDH and HCG. Chronic endometritis is characterized by what and what in the endometrium? It's characterized by lymphocytes and plasma cells in the endometrium. Remember, lymphocytes are normally seen in the endometrium Plasma cells are not. Lobules and small ducts of breast tissue are present in highest density in the what quadrant? The upper outer quadrant. What age group is associated with testicular germ cell tumors? Men 15 to 40. Which brachial arch gives rise to the lesser horn of the hyoid? Is it the second or third? It's the second. Which brachial pouch gives rise to the epithelial lining of the palatine tonsil? The second branchial pouch. In which week of embryogenesis do genitalia begin to develop male or female characteristics? Week 10. Think tenitalia. Cori disease presents as a milder form of von Gerke with blank blood lactate levels, normal. In which week of embryogenesis does the heart begin to beat? Week 4. Which branchial arch gives rise to the anterior belly of the digastric? The first arch. What is the embryonic origin of the ovaries and testes? The mesoderm. With exercise, increased cardiac output, there is vasodilation of what capillaries? Blank capillaries in the lung, which causes the VQ ratio to approach a value of 1. We're talking about apical capillaries. I'll read that again. With exercise, there is vasodilation of apical capillaries in the lung, which causes the VQ ratio to approach a value of 1. In blank limited gas exchange, diffusion can be increased only if blood flow increases. Perfusion limited gas exchange. The transmural pressure across the lungs is calculated as what pressure minus what pressure? Alveolar pressure minus intrapleural pressure. That's the transmural pressure. A blank globin molecule has the potential to bind 4 oxygen molecules. Hemoglobin. Decreased hemoglobin, for example, in anemia, is associated with what type of SaO2 or regular O2 and PaO2? So decreased hemoglobin is associated with normal SaO2 or serum O2, decreased oxygen, and normal PaO2. In the blood, free radicals may take an electron from apoprotein B100 on LDL, forming oxidized LDL. When 4 glucose units remain on a branch of glycogen, what moves 3 molecules of glucose 1-phosphate from the branch to the linkage? Debranching enzyme. Blank may be converted to methionine via the enzyme methionine synthase with methyl THF and vitamin B12 as cofactors. Homocysteine. Microtubules are cylindrical outer structures composed of a helical array of polymerized heterodimers of alpha and beta tubulin. Blank is a metabolic disorder associated with black-colored urine after prolonged exposure to air. We're talking about alkaptonuria. Polycytosis refers to cells of varying shapes. Basophilia is uncommon, but can be a sign of myeloproliferative disease, particularly with CML. Most cases of serum sickness are now caused by drugs acting as haptens. The Charcot triad of multiple sclerosis may be remembered with a mnemonic SIN, scanning speech, intention tremor, also incontinence and INO, and nystagmus. Homocysteine may be converted to methionine via the enzyme methionine synthase with methyl THF and vitamin B12 as cofactors. Remember, methionine synthase is also known as homocysteine methyltransferase. Charcot triad of multiple sclerosis may be remembered with a mnemonic SIN. Can you remember it? Scanning speech, intention tremor, and nystagmus. Okay, so that's a very good review of Zanki. Check out Zanki if you want to review for the USMLE. Thank you very much.